I think when you're treating children, the focus is less on the tooth that you're actually working on and more about who that tooth is attached to, who that child is. And sometimes in dentistry, we lose sight of the big picture. And for pediatric dentistry, it's more about what you're creating. You're creating a young person who you want to have confidence, who should have confidence one day. I think it's the people. Luckily, I had some say in that, but I was able to surround myself, and I think the entire practice, we're all surrounding ourselves with not only like-minded people, but overly friendly people. And that helps when dealing with children. You get to create an environment where everybody's comfortable, where nobody's thinking that somebody's looking over their shoulder, or am I doing my job right? And when you have an environment where everybody is confident in what they're doing and knows exactly what they're doing, the patients see that. And I think everybody kind of feeds off of that. And I think being comfortable, especially with children, creates a certain sense of calm. And that sense of calm allows us to do our job a lot more easily. The staff here at KinderSmiles is all of one mind. Our main focus is on your child. We want to take this young person, this young patient, and throw them into our family, throw them into this environment where everybody's happy. Everybody knows that you can do this, even if the child is uncomfortable or doesn't think they can. And that starts from the front desk. It even starts from the phone call, which I know the patient isn't going through, but certainly the attitude that a parent might feel will sort of translate onto their child. So we try to make everything as comfortable as it could be. You'll hear a smiling voice, even though you can't see a smile. When you walk in, there'll be a smile on everybody's face. There will be a certain sense of calm. Children react to, without even realizing it, they react to the feeling that the people around them are having. If we make this too important, it's going to put a lot of pressure on them. And that's what our staff tries to do. We try to not only give that extra smile, but create a sense of calm where if a tray falls or something falls in the hallway, it's not, oh my God, like it's not the biggest deal. It's something that is going to be okay. And the hygienists that we have here at KinderSmiles follow a very specific philosophy. It's not about pushing children through things or through cleanings that probably, if they're struggling, is not going to be something that'll be all that effective anyway. It's about building up over time not only a sense of trust, but a relationship that allows the children to feel very comfortable in what they do. And that starts from our hygienist's personality. It's going to be okay is really the philosophy that our hygienists work with. Sometimes children need to have that tooth scrubbed a little bit harder or something sort of scraped. If that means the parent is going to sit with them in the chair, or if your child is more comfortable with you in the chair, that's great. If it means having the child sitting with a sibling on their lap, that's okay, or taking anything with them. Sometimes there are children that don't like the tastes of certain toothpastes that we use here. We tell them to bring in their own toothpaste, the one that they use. Sometimes they don't have any toothpaste that we like, and we kind of gradually build them into a patient that will be comfortable with not only the sounds and the feeling, but also the tastes that they might have when they're coming to see our hygienists or coming to see the dentist. Getting through a dental procedure for a child is not the easiest thing very often. We have a very special person in our office that I like to call a hand holder. She will help a child get through a procedure in any way that that child needs. Sometimes it's telling the child, you can do this. This is something that you are going to be able to accomplish, and giving them that confidence. And sometimes it's a whisper in their ear, if you do this, you'll get one extra toy from the toy box. And whatever that child needs, she knows. That feel, that being able to understand where a child is coming from and what thing is making them nervous. Sometimes a child starts to get a little upset, and Kerry knows it's not because of what we're doing, it's because a commercial just went onto the TV and their TV show stopped. Little things like that. And sometimes we'll take a break. Let's wait until SpongeBob comes back, or until Umi Zumi gets back onto the TV, because we know that was helping, and we could wait 2 extra minutes and allow you to be as comfortable as you can be. And that's a talent that Kerry has, to be able to understand or get into that child's mind and to know exactly what that child is feeling, and to be able to tweak the things that we do for that particular child to make their experience much more pleasant.